My name is Amy Smith. This is speech number 3, another informative speech, and this is my audience. Some people hear the word pressure ulcer and are unsure of what it even means. The more common name to some of you would be bed sore. When we think about bed sores, we think the worst. However, there are several ways to prevent bed sores from forming. Today, I'm going to talk about what a bed sore is, how they can develop, how to help with prevention, and what complications may occur, as well as some of the fines nursing homes can acquire if pressure ulcers are acquired while in the nursing home. A pressure ulcer is an area of skin that breaks down when residents stay in one position for too long. Often happens to wheelchair-bound and bedridden patients. They can develop very quickly, and it's caused by constant pressure against the skin that reduces the blood supply to the area, then the affected tissue dies. Pressure ulcers develop, they start as reddened skin, but they get progressively worse. Blisters can form, open sores can result from the blisters, and craters can form, which is a hole in the skin to expose the deep tissue, ligaments, and bones. This came from the Nebraska Pressure Ulcer Association organization website. The most common places for pressure ulcers are over bony areas such as elbows, heels, hips, ankles, shoulders, your back and your spine, the back of the head, the buttocks, and the coccyx, which is also your tailbone, backs of both legs and arms, and then you can get them behind the ears from like oxygen tubing and such like that. The types of pressure ulcers are stage 1, which it just starts off as a little bit of redness. That's all you can see, and what happens here is that if you touch on it, things should blanch, and if it doesn't blanch, then you know it's a pressure ulcer. Blanching is when you touch your skin and like it goes white right away. You know it's pressure because if you touch it, it just stays red and it doesn't blanch. Then we have stage 2 pressure ulcers, which oftentimes start as blisters over the areas. When the blisters open, this is what happens here. So this is a superficial open area with a little bit of epithelial tissue exposed. And then we move on to the stage 3 pressure ulcers, which in the open areas you'll see a little bit of yellow stuff, which is called slough. These are considered deep wounds, and they may look like a crater without yellow or without infected areas, and it goes into the healthier skin layers, as you can see here. And then we have stage 4 pressure ulcers, which are the final and most advanced, so damaged that the bones, tendons, and muscles may be exposed. Bottom part of pressure sore may show slough and dry dead tissue, also known as eschar. So that's kind of what this is here. And eschar in English terms is just scabbing. This yellow stuff is all dead tissue. That's called slough. And then we move on to unstageable, which these are 100% eschar. So we call these unstageable because you have no idea what's going on underneath these black areas here. Most of the time what will happen is these will dry up, and then underneath will be new skin, but as of right now, we consider these unstageable. So, I got this information from nursinghomeabusecenter.org. Prevention is key. What you need to do is identify the patients that are most at risk, checking for comorbidities, which are underlying medical conditions such as Alzheimer's, diabetes, poor circulation. Are they ambulatory? Can they move on their own? Do they need help? Malnutrition. And then when you identify your patients that are at risk, you want to implement appropriate interventions for pressure reduction, such as you want to offload the heels when in bed to avoid stuff like this. Lots of times air mattresses are used, Roho cushions, which are cushions filled with air that alternate the air when they're sitting. And then to keep them off their backs, you use a wedge behind the back. to keep them up their buttocks as well. Turning programs are good just to make sure they're not in the same position for too long. And then weekly skin sweeps and daily skin checks are something that we do, just to make sure, you know, everything is okay, especially over the bony areas. You want to look for any abnormalities on an admission skin check when they're admitted to your facility, and make sure that that's documented upon admission. And then, of course, if they are at nutrition risk, you want to make sure that a protein supplement such as Boost or Ensure are on board for them. Some of the medical complications from pressure ulcers are joint and bone infections, because the infection can get to the bone, which would be osteomyelitis. You can have sepsis, which is a bacterial infection that occurs when the bacteria enters the bloodstream of the body tissues. This can cause organ failure and other issues. Takes IV antibiotics to cure this. It's a lot of hospital time. Cellulitis, which is inflammation of the connective tissue, can occur. If cellulitis occurs, victims may develop meningitis, which would affect the fluid that surrounds the spinal cord and the brain. This information was taken from the mayoclinic.com website. So some of the treatment for the pressure ulcers would include stage 1s would require a combination of antibiotics if needed, and cleansing solutions. So pretty much you just want to make sure that if it's a area on the buttock, you know, barrier cream, make sure they're clean. If they're incontinent of bowel and bladder, make sure that, you know, you keep them dry. Also make sure that they're repositioned frequently. And then anything stage 2 and above, normally you have a doctor's order for some type of treatment. Sometimes if it gets bad, like your 3s and 4s, they undergo surgeries for surgical debridement. Sometimes you might need a muscle flap. It just depends on how bad the area is. So it just dressing changes. Pain management is also something that you want to look at with your 3s and 4s, as those can be the most painful. So then we have the financial impact of pressure ulcers on medical facilities. Every pressure ulcer related hospitalization averages 13 days with the cost of $37,500. Pressure ulcer care and treatment costs medical facilities an estimated $11 billion per year. The facility fine can be up to $25,000 per occurrence. The average cost of healing a pressure ulcer ranges based on stage. Stage 1s, you have just under $2,000. Stage 2s, $3,000 to $10,000. Stage 3s, $5,900 to $14,840. And then your stage 4s, to unstageable, you have anywhere from $18,000 to $21,000, just depending on the treatment that's needed for that. The average settlement in a lawsuit involving facility-acquired pressure ulcers is $575,000, but juries have awarded settlements as high as $29,100,000. That information was taken from ManagedHealthCareConnect.com. So as I come to an end, I would like to thank you all for allowing me the opportunity to educate you on what a bed sore is, how they can develop, how to help with prevention, some complications that may occur, as well as some of the fines nursing homes can acquire. If you have any questions, please feel free to ask me, and I would like to answer them now. Hopefully you learned a little bit of something you didn't already know today.